Hi everyone, I'm Dr. Tan Yiping, consultant obstetrician and gynecologist. Okay, let's go back to endometriosis. We have gone through so many videos now. So for those of you who have missed the previous videos, you can go to my YouTube channel, which is in the link below. Remember to subscribe to my YouTube channel and then turn on the notification button so that every time there's a new video, you will be notified. Of course, endo can cause it because for frozen pelvis, there's only two possible causes. It's either endometriosis or pelvic inflammatory disease. There's only two. So definitely endo can be a common, in fact, it is a very common cause of frozen pelvis. Frozen pelvis is when the entire pelvis is frozen, because what happens is normally your uterus is free to move left, right, front, back. Okay, the tubes is also free to move, so they're going to catch the egg. The ovaries is also dangling down there, free to move. Everything is free to move. The bowel also can move here and there one. But in frozen pelvis, everything stick to each other. So your bowel and your uterus stick to each other. Your tube stick to your ovary stick to the bowel, to the ureter, to the muscle, to the bladder. Everything stick to each other. And because endometriosis is a very hard thing, so the thing that causes it to stick is endometriosis. And endometriosis is hard. So the thing that is sticking is hard. So can you imagine if you have a bunch of things, you stick them next to each other and use a hard glue, that means this glue when dry up, it turns hard. So the whole thing, like a whole chunk of things, become hardened. So that's why we call it frozen pelvis. It's like frozen, whole thing hardened and fixed, and there's nothing you can do. And it's actually very common. But honestly, why people use that word? It's very commonly used when people find the surgery difficult. In fact, quite sad sometimes when there are patients that go for a surgery and then the doctor do the surgery, open up the tummy and say, oh, you have frozen pelvis. Then they close up the tummy. They did not do anything. They did not remove the endometriosis at all. They just close out everything, and then they tell patient it's a frozen pelvis. Surgery is too complicated and too high risk, so we cannot do anything. But honestly, to the patient, it is a very horrible thing to do because she's suffering. Frozen pelvis, usually these women are suffering. They're suffering very, very badly. And you somehow open her tummy, which is a major surgery, and then close back, which it take 1 month to heal. And you didn't do anything. Oh my God. So like that lor. So very often, patients only hear the word frozen pelvis is when the doctor actually gave up on them. Gave up doing the surgery on that. And it is very common when you actually had your surgery done by doctors who are not skillful enough, not trained enough to do this surgery. So I don't blame the doctor. That's why I always describe to a lot of women that endometriosis surgery is the most difficult surgery to do in the world. And it comes to abdominal surgery. When you go in, open the tummy, endometriosis is the most complicated. So doctors need to be trained to do endometriosis. So not all gynaes are trained. If with robotic, it will be so simple. Laparoscopic, still possible. But I will never do it as an open surgery. So that's all for tonight. See you again. Bye.